I'm Jeff Toll, MD, an internal medicine doctor here in Los Angeles, California. Today we're going to be talking about COVID-19. Started in China, a type of coronavirus that is causing a severe respiratory syndrome with fever, body aches. There's been many other coronaviruses that usually cause just the common cold, and in the last few years, a few of these viruses, you may have heard of SARS and MERS, have been more severe. And this is the first one of these more severe coronaviruses to spread around the world. A lot of people wonder, can I be asymptomatic and still be contagious? The answer is a big yes. The reason we are all staying at home, the reason you're not in a restaurant, is because people who are not symptomatic may be carrying the virus and they can give it to you and spread it around the community. So this is the real reason all of us are at home. So a lot of people are wondering, what's the story with treatment? How do we treat this thing? Mostly what we're doing is symptomatic treatment, things like Tylenol, things like albuterol or breathing treatments for those of us who are having severe cough or breathing problems. There are a number of candidates as antiviral therapy. Our president's talked about a few of them that have some potential to be helpful, but all of these are in very, very early trials with no scientific data yet. But things like medications and vaccines will be coming in the next months to years. In terms of what are the over-the-counter treatments that we should be doing when we're at home with this virus, Tylenol is very important to keep the fever down. Things like albuterol, which are breathing treatments, can be used for those of us who are having severe cough or respiratory problems. There's some data that Advil, Motrin, the NSAID drugs are actually causing symptoms to get worse. So for right now, we're avoiding those drugs if you think you may have coronavirus. The whole question of testing is really a big problem right now. Everyone wants to know, do I have it? If I'm asymptomatic, do I have it? If I'm having a cough, do I have it? But the problem is right now we just don't have enough tests. So for the most part, unless you're so sick that you're gonna need to maybe be in the hospital, there are not enough tests for us all to be tested. Current recommendation is to call your doctor to go over it with them, but in general, if you're sick with a cough that's mild, with a fever that's manageable with Tylenol, most of us should really be staying at home instead of trying to get tested. Right now, these testing centers are backed up, and every person who goes in to get tested, that's another set of masks, gloves, gowns that are burned through. The hospitals are really running out of equipment. So for now, if you're doing okay at home, you really should stay home and don't worry about getting tested. A lot of people are wondering during this quarantine, is it okay to do activities outside? I know a lot of people are trying to manage their mental health, trying to figure out cooped up inside the house. So the answer is yes, it's okay to be outside, take a walk, take a bike ride, but you have to respect this distance of about 6 feet. So if you wanna meet your friend for a walk or a bike ride, that's okay, but you have to walk 6 feet apart from each other so that you're not accidentally infecting each other. That's why they're gonna end up closing the beaches, because people can't be right next to each other. That's exactly how this disease spreads. So the big question is, when will this all be over? And none of us really have that answer yet. The government right now, with these policies of people staying at home, is to stop this steep increase in the number of cases so that the hospitals can handle the volume. But unfortunately, so far in the US, they think there's somewhere between 50,000 cases and 500,000 cases, but there's 300 million people. And so at this point, we're probably weeks, if not realistically months away from everyone being able to be outside again. There's one question that we have to figure out is, if people are truly immune to this virus after they've had it, which we think they are, then eventually we may be able to develop a test that we can take at home to prove our immunity. And then if we're all immune, those people who have officially been said that to be immune through the test would be allowed to go back outside again. The last thing I wanted to mention was just this one plea. The reason we're doing this is for that, 10% of the population that's really at risk. Our grandmothers, our parents, people with medical problems, all of us staying at home is what's gonna save all these people's lives. Because while young people, for the most part, are not getting that sick, they're doing okay at home. If the hospitals get really full, then it's possible that a significant amount of elderly people and people with medical problems can die from this. I'm Dr. Jeff Toll, thanks for watching. Follow me on Instagram. Comment below if you have any other questions.